Good afternoon, and today I have a pleasure to interview my friend and neighbor, Dr. Tola T'Sarumi. Dr. Tola, good afternoon.
Hi, Dr. Maria. Nice to meet you guys.
And in today's conversation, we're going to discuss topic very close to my heart. We're going to discuss depression, suicide, prevention, addiction, and emotional pain, and try to break the silence around mental health. And Tola gonna share with us her deeply personal experience while she choose this mission in life and stigma, what keep people suffering alone, and how healing require compassion, connection, and approach to whole body health, and especially sleep. And we're also gonna explore non-medication treatment for depression. We're gonna talk about transcranial brain stimulation. That's the unique treatment what Dr. Tola used in her practice to help people with different type of mental health, including weight loss. And I hope she's going to bring a lot of hope to the patients with that conversation. So in my short, we become friends recently, but I'm so impressed with Dr. Tola training. She's Columbia and Harvard double board certified psychiatrist and addiction specialist. And her clinical work focus on underlying breast function, stress physiology, and emotional regulation, not only on a mental health, but also sleep quality, recovery, overall systemic health. We're going to talk about how we can increase that REM sleep, what can improve the memory and take off the mental fog, what a lot of my patients complain about. And she's a founder of psychoaesthetic medicine. That's a very interesting intersection, and I'm so passionate about anything related to aesthetic and beauty. And she shares her time between two states, Massachusetts and New York. And I really enjoy our collaboration. So please share Tola, your story. Why did you choose this area of medicine? What touched you personally to become psychiatrist?
Absolutely. Well, it's wonderful to be here joining you. Thank you so much for inviting me. When I think about psychiatry, I say it was literally a calling. I always knew I wanted to be a doctor. It was just a matter of like what specialty. And at the time, it didn't really, I didn't understand at that much. I would say we had a personal loss of my uncle who died by suicide. And I think for us as a family, just having to deal with that, that was something very deeply personal for not just me, but my entire family. It shifted in the way that I didn't even understand psychiatry at the time, right? I was still in school at the time when he passed, and just seeing how the impact of it affected my family. It wasn't something we talked about. The brokenness from my mom, grandmother, it was just unreal. So, it shifts, it changes the dynamics of everyone's life and how we perceive things. It wasn't something that we saw, a lot of times there were signs, and yes, there could be signs, but when you're not still, it's not a conversation that is spoken about easily, or there's that stigma, which we've had a huge stigma for so long. I think that played a role because, it's just like, oh yeah, you're having a bad day. Okay, go figure it out and get back to work or get back to whatever you're doing. This is someone who, was the first in his class, he was studying, actually, he was a medical doctor. So he was in the prime of his life. Everything looked great, on the outside to everyone, but he was unfortunately struggling internally. That was not seen, recognized, and had gone unfortunately untreated. And so the experience really shaped how when I started to consider medicine, the areas, yes, I had areas I was, kind of gone back and forth with, but by the time I was in my specialty, my training, and I knew look at psychiatry, this was exactly what I wanted to do, because I wanted to understand like what could we have done differently? What are the signs? And today, yes, we have our textbook signs of what we expect to see from someone who has depression. You talk about isolation, talk about, either excessive eating or not eating, sleeping or not sleeping. All of these things, they're there, but there's also that percentage of people who do not show up with those symptoms. And so it was something that really stirred a lot of interest for me personally, and understanding stress, biology, the environment, how all of this plays a purpose, plays a role in one's purpose. And so that was really critical for me. And so definitely pushed me towards the area of psychiatry, and always head and fudge because, yes, I've seen suicide's impact on myself, my family, and how you look at and view people. And so now being in that space and being able to talk to patients and recognizing the symptoms, even the good and the bad. Yes, we can't be with them all the time, but you can hear things that are very subtle. People think, your appointment might just seem like one, but there are a lot of things we're listening for. And so that has been very, it's shaped how I practice today. So I don't just treat symptoms. I really do view that whole person, their story, their stress, because it's always building on something. And you can tell when there is a shift with that. So I look at that whole person, again, and what it is that I want to be able to navigate and help them with. So, I would say in that line where I have seen it firsthand in my personal experience and then working with patients today, it also has delved or led me into looking into other innovative treatments, because I'm always like, well, the medication is great, it's helping, but are there other options? So again,
Yeah, we're going to talk about that. That's I'm so passionate about.
Yes.
Doctor, I want to ask you about that part, about the depression. And personally, depression, I talk about that in my book. I touch a little bit mental health in my book, Breathless, but in real life, most of the patients who come to me, they have depression and anxiety in a medical history. So I want to ask you how anxiety can look like if it's not only the panic attack. What, it can be hidden. Like you talk about those invisible signs of depression, invisible signs of anxiety. Maybe for person, for himself or herself to recognize, but it's not just the exhaustion of the day, but it's actually, we can say, the disease or condition what require intervention. What are the signs we have to watch?
Yeah, no, absolutely. So again, we all know that there are physical symptoms that might manifest for depression. So the standards we typically look at is for, you're looking, of course, suicidal, right? Are they having, guilt? Are they having poor sleep, increased sleep or decreased sleep? Are they eating too much? Are they eating too less? Are they concentration with that? What's happening in that sense. And so these are all the things you're looking at for the standard DSM criteria when we look out for depression. But there are some other hidden things that you see. And, one, for example, our high functioning, where we're talking about, you hear a lot about high functioning depression. So this is someone who's not just working and not pausing, because by pausing, that can actually make them begin to feel the emptiness and all that is going on there. There could be, so they could be doing really great in work, but they're, again, I always say you never know what happens when someone puts their head at night to go to bed, because that's really tells the story. There's that conception that they might have for someone with anxiety, just constant neck pain, jaw pain, headaches, migraines. You hear that a lot. They can present with like GI symptoms like nausea, even like IBS-like symptoms, right? It vacillates between diarrhea, constipation, chest tightness, palpitations, fatigue. So these are some of the stuff you might see with someone who has anxiety. And, it might not seem clear. It might just feel like they might actually present with, it might look like a physical illness rather than, and of course, when you do your medical, we always say we rule out everything medically, make sure there's nothing medically going on. And then, of course, a lot of times it falls back onto the depressive or the anxiety that it's experiencing. So someone, again, could have racing thoughts, that, where people say they feel like they're having a heart attack sometimes. You hear that, or in conversations with them, you just see that they are not there. They're present, but they're not present, right? So their minds are like thousands of miles away. Irritability, you might see that they're easily overwhelmed, snapping at people. So a lot of times it's not just there's personality, but it could really, if it's not the typical person or the typical personality, those are like symptoms and signs that you can look out for. Just feeling on edge constantly, avoidance behaviors. We talk about that, procrastination, avoiding emails, calls. Just so many things that these are like more the hidden things we overlook, because they're present, but people show up that way. So, I mean, I think for between anxiety and depression, there's a significant overlap there. But I'll pause here and
Yes, that's, you describe standard patient who come to my practice. So I want to talk a little bit about how all of it, anxiety, depression, suicidal thoughts affect sleep and what you see, and how you can help with non-medicated way. Like, I want you to talk more about this treatment, what not a lot of people even aware.
yeah. So, first thing I always say is, if you're having any of those symptoms we just talked about, so you're feeling depressed, low mood, not enjoying the things you once enjoyed before, you've spoken to your doctor, your primary care, which is usually the first point of contact. They might say, okay, well, we'll start you on a medication or we'll refer you to a psychiatrist or to a therapist, right? And you've started to engage with this treatment and nothing is happening. We've taken a step further. We have interventional psychiatry, and that's an area of significant interest and treatments that we look into. So like TMS. TMS is transcranial magnetic stimulation. This is a treatment for, again, overwhelm, depression, anxiety. I say it has so many options: PTSD, insomnia, cognitive impairment, autism. We're seeing so many things, concussions, the list goes on and on. So if you can think of it, I say, I'm sure we have something that can help you there with it. But it's a treatment that truly helps when we talk about neurons reactivating the pathways in the brain, something called neuroplasticity, the ability of the brain to rewire itself, to adapt to changes. And so first, I think we're already like very blessed enough to have that opportunity to be able to have a brain that we can rewire itself, right?
Yes, yes.
So just because you have something bad today doesn't mean that you're stuck there. There is the ability for the brain to reset. And, that is exciting to see that TMS can actually engage that. I always say that, think of, your battery of your car is dead and you're jump starting it. TMS is jump starting your car. It's jump starting that part of that needs that reactivation pathway. So again, it begins to set the neural pathways in order, and you begin to see that connection taking place. They're firing together, wiring together. We talk about Hebbian learning, and then we're seeing things move in the right direction. So,
but my question, and I know a lot of people when we had event together, they ask how exactly it look, because we don't have it, anything to show here. And is it painful? What sensation you experience? So, it's not a little thing to lose. That's the brain.
Yeah. So, the exciting thing is it's FDA approved. So, and we know that the FDA goes through a rigorous process with all of this. So it's FDA approved. It is a device. It's placed on the dorsolateral prefrontal cortex of the brain. And so it's non-invasive. So it feels like a tap-in. Some people talk about it feels ticklish, like you're having a tickle in your head. And so when I kind of describe it, I'm like, think of it as you're going to the gym for the very first time and you're working out. What are you experiencing when you work out? You feel sore. Your muscles feel sore because it's the first time. You're going there to get a brain treatment, a stimulation treatment. So you're, in a sense, kind of working out your brain in, a short period of time. Treatment usually lasts anywhere about under 30 minutes of treatment time. So you're kind of working the brain because we want the brain cells to wake up. We wanted to reconnect together again. And that's what we're seeing here. And so it does feel like it's a tap in on the head. It might feel like it's ticklish. It's not painful. I mean, I talk about it all the time. My youngest patient, 5 years old, oldest I've had about 83, 85 now. So we've had like a vast, a variety of ages and age groups that have gotten the treatment. It's very, personalized to what your needs are, whether it's anxiety, depression, sleep, burnout, stress, overwhelm. We're in the, menopausal stage. You're hearing a lot about the brain fog. So again,
yes,
it really is very personalized. And so the treatment can vary on what we do, and as well as the intensity. And it's comfortable. It's, you're able to literally come on your lunch break and go right back to work, and so I call it your break, your neuro spa. So think about it. You're going to the spa for your facial, but you're coming to TMS Plus Mind MD for your neuro spa. The brain is actually taking its own facial treatment.
I want to mention to my audience what Dr. Tola offering, I would say, a reduced fee. I don't like to talk about money, but reduced fee package for people to try that treatment. We're going to put it underneath the interview, and her address right next to my office, 119 West 57th Street. It's going to be on the 10th floor, right? 10th floor, but the doorman will direct you to her office, and I'm sure it's going to be on Google, and we're going to put the address underneath the interview as well. It's all so interesting. So I have a question. For example, for depression, anxiety, or suicidal thoughts, do you position the electrodes in a different way? Like, what's the difference, or is it a different area of a frontal lobe you're stimulating? Like, tell us your secrets.
Well, I can share a little bit. So again, when we're treating depression, even insomnia, a lot of things that's at the prefrontal cortex, and that's because the dorsolateral prefrontal cortex, and that's because we have recognized that is where emotions are, right? Our cognition is ability to, when we talk about executive functioning and treatment and logic, reasoning, all of that is in that dorsolateral prefrontal cortex, on the left side, and so that is really where we focus our treatments on. Now we have patients that can be treated for bipolar depression, which is an inhibitory process approach. Again, that is very specific. There are certain protocols that you would use for that as well. For anxiety, I always say sometimes for every individual is different, right? But for depression, a lot of times in 6 treatments, you can actually lift and get the person doing much better. With anxiety, there are many variables. So when you go through your consultation, we try to figure out what's the source of the anxiety, because if it's an anxiety that is ongoing, maybe you have to go to work and that is the source of anxiety, we can help you out, but also we are going to look at addressing the initial, the whatever is the cause of it, right? And so that we know, because anxiety about things happening, like, okay, for example, we had the bombing in Dubai. So we have patients who are doing very well, and all of a sudden there's bombing and there's declaration of war or something like that, right? So these are people who've been stable, doing well, and all of a sudden this literally, we got so many thousands of calls, just we're stressed, we're anxious, and all of that. And so environmental factors continue to weigh in and affect that. So even if you're doing anxiety, you get your treatment, you do well, nobody knows tomorrow, but at least you do know that you have a treatment that can come in and help mitigate that and get you back right on track with this approach. So again, anxiety can vary, and then the locations as well as the timing of the treatments really becomes very personalized for the individual, based on the presentation, based on the consultation.
I like how you approach, like it's investigative, like my Sherlock Holmes approach. You're trying to, and I like when you say about environmental factors. Yes, for a lot of people it can be work. For some people it can be private life, and different approaches. But, because my program devoted to sleep a lot, mental health and sleep, they're very close. So I want you to share with us practical advice, how people, what they go through, going right now, modern life. And I mentioned that fact, and I want to bring it to my audience, what Dr. Tola does really had a big place in my heart. I live in New Jersey, a totally normal place, but when I moved here 10 years ago, on my street, we had 7 cases of suicide, including father of the boy from my son class. And that happened, and it just threw something shift inside of me. Like I was thinking how that can possibly happen. So, I already, adapt to that thought. I already accept those losses. It took me a long time, but I want you to give us practical advice. We already know the signs, so we watch for the signs. But what if exhaustion doesn't go away? What if numbness come to play? What if, like, what practical advice you can give to people who cannot, jump in to get the treatment? That's number one.
Yeah.
That would be great thing, but we have audience everywhere. So what are the steps? What somebody can pull himself out, or at least try a little bit? What would be the practical steps for family members and a person? How to?
Yeah, absolutely. So again, practical steps we already know about, our lifestyle, truly affects this. So we talk about sleep a lot of times, sleeping well is so critical. Talk about even just getting sunlight exposure, physical activities, some form of movement. And no, you don't have to join a gym to have movement, right? Walking up and down the staircase is getting your body moving, getting that epinephrine, right? To, adrenaline kicked in to give you that energy, that boost. So again, that's a good way, stress reduction practices, deep breath. We talk about deep breaths, taking deep breaths in and out, using the 5-4-3-2-1 rule, limiting, like a lot of, we talk about caffeine, but you want to limit, caffeine, especially late in the day, reducing excessive amount of screen time, things that we already know.
But it's hard to live without it. That's true. We know about that, but it's hard to force yourself to do the physical activity. It's hard to force yourself to get it to the daylight and stop watching the screen. So that's all very useful advice.
Yes. So, and of course, just having some time for yourself. It's so important. We talk about meditation, time to just quiet everything down, right? It's important to take a day, some time out of your day to be able to just meditate. Moments of stillness kind of helps with recovery. Journaling is a key one. People really miss out on journaling. I know today we're all typing on our phones, but sometimes it's a different pathway and the way the brain works when we're writing down versus when we're typing. So again, that is something that, you want to look into as well. Supportive relationships, it's so key. I know in today's world, nobody calls anymore. We're just texting, but make it an effort, even if it's just, I say, make sure you have at least 3 to 4 people you check upon in a week. So every other day I'm calling XYZ, and so these are things you should do because, and not just texting. Yes, you can text them to kind of get them knowing that, but calling is so critical, because hearing one's voice, you can text and person says, oh yeah, I'm fine. But when you talk to them, you can really hear, are they truly fine? Or is there something else going on? So these are things that we miss out on. Of course, you're able to do this. I have what I call the reset key, so R is rest, sleep, and recovery time. E, of course, exercising, moving your body, some form of fashion. I talk about S, stress regulation, learn how to calm your nervous system down, those breathing exercises. E is, eating to fuel the brain. So your nutrition definitely affects and impacts your body as well, reducing excessive sugar, processed foods, and of course, talking. We talked about reaching out to friends, family, loved ones, and even a therapist. I think in today's world, we all should have a therapist, really, someone you talk to, and there's no bias and there's no judgment, and that's the role that a therapist can really play, and help you in terms of figuring out things. Now, if you've done all of this and you're still suffering or still struggling, now it's time to seek professional help.
I really like that abbreviation, reset, right? Reset.
Yes, reset.
I love it. I want to put it underneath our interview because, with acronym, it's really stay in your mind. So I appreciate all this wonderful knowledge you share with us,
Yes.
Dr. Tola, and I hope people can try the treatment using that package.
Yes, absolutely.
Thank you very much.
Thank you.
And people can find you with the address we put underneath the interview. Thank you.
Absolutely.